what else can we do? What else can employers do? I think we need to have innovations and see what works. And so we're going to have a discussion of that now with two different approaches, one sort of from a larger perspective and one from a smaller business perspective. So this is going to be more of a discussion, but we do have concrete examples. And I'd like to just introduce you to the two other people, and I'm going to have them explain a little bit about their backgrounds as well as their particular angle or interests and specifically their organization as well. So I'm going to start off with Erica Botka, who is the Assistant Vice President for Talent Development and Human Relations at an organization that, even though it says University of Michigan Credit Union, it is actually not part of the University of Michigan, but it was at one time. So, Erica, why don't you begin?
All right. Well, thank you, Sagar, and thank you so much to everyone who stuck around for the last session. I'm sure it's going to be wonderful. As Dr. Parikh had mentioned, my name is Erica Botka, and I'm the AVP of Talent Development and HR here at the University of Michigan Credit Union. And I think it's going to be interesting because UMCU is a smaller organization, and Kate's going to tell us about her wonderful program at a much larger sized organization. So to tell you a little bit about UMCU, I am sure we have plenty of members, hopefully, in the audience today. So we are a financial institution. We have over 100,000 members. We serve the state of Michigan, and we have branch locations throughout Ann Arbor, Ypsilanti, Dearborn, Flint, and Northville. So our approach really is to be very all-encompassing with our approach to mental wellness in the workplace. And what I mean by that is I'm probably going to use the term layering a lot today, but we really look for any way that we can layer in mental health into our team members' experience from the day the recruitment process starts through the day they hopefully retire from UMCU. So we really look to create a positive work environment for the team members. We lead with empathy, and that leadership obviously is so important. We've heard about that a lot today. We really try to identify how we can support the unique team member in a very authentic way. And I know we'll dive a little bit more into some of the programs we have here, but to hit a few programs that we do have here: a full court wellness program, which is our wellness program that focuses on mental health, of course, financial well-being, because that plays a big part in mental health, and physical wellness, because they're all really tied together. We have worked previously with the Depression Center and having them come in and do a multi-part series with our leadership team to help us gain understanding into mental health, how we can influence that in the workplace and destigmatize it as well. So I'm really excited to, as we unfold the session, tell you even more about some of our initiatives.
Thank you. Thank you so much, Erica. And our next first panelist is Kate Fisher, who's Senior Director of Total Rewards at the Cummins Corporation. Tell us a little bit about yourself, Kate, and a little bit about Cummins.
Thank you, and thanks for having me. I'm excited to be here because I am a Michigan native. I live in Dearborn, and but Cummins is based in Indiana, so it's always nice to do things in my home state. So I'm Kate Fisher. I presently lead Total Rewards and Wellness Strategy Development, but since 2020, I led Global Health and Wellness at Cummins, and that's really my background working for automotive suppliers in the Detroit area. So at Cummins, we are based in Southern Indiana, and we manufacture diesel engines, but we also manufacture very large power systems that go into trains, ships. We power the London Eye, and I think we still power the Taj Mahal. So we have a pretty vast manufacturing structure. But we have a diverse population. We have over 70,000 employees around the world. We're in 160 countries. So we're a pretty big operation. Cummins, when I started, it was the middle of the pandemic, and I was really surprised and delighted to find out, and it's unexpected for a 105-year-old manufacturing company. But Cummins has a very progressive outlook, and they definitely foster a culture of care, which can sometimes get lost in having 70,000 employees in 160 countries. So Cummins has always put employees at sort of the center of what we do, because they are necessary to run the business well. As part of that, we have a pretty significant wellness program, and I'll tell you more about it as we talk. But in 2020, in the midst of the pandemic, when everybody was struggling, including our leaders, our employees, everyone, we knew we had to do something. And so we created a homegrown mental health program called It's Okay, which the name isn't particularly clever, but it's clear. And it has grown since then. And our goal was to destigmatize and normalize discussions about mental health. And it has grown from there. It now encompasses, we've covered 50 topics in 3.5, almost 4 years. And it has now, it now encompasses all of our pillars of health. So our financial, social, and physical as well. So I'm looking forward to the discussion. And telling you how, what we've achieved and what's worked and what hasn't worked for us.
All right. Well, that's quite a different scope. 70,000 employees, or perhaps versus 70,000 customers. I don't know, but so for each of you, one of the first questions is really, is there any one program that you are particularly proud of? And can you explain it in some detail? A program that has really had some traction, has had some uptake. There are many programs that are well designed from a scientific or health or medical perspective, but you can bring a horse to water, but you can't always make the horse drink. I mean, there are many things that don't get utilized, even though they're well thought out or well designed. If you could focus on something that actually people used. So Erica, do you want to just comment on that?
Yeah, and I think I'm going to take this to some of my favorite things to talk about, which are ways that are really fun and creative. And of course, when we're talking about mental health, we do all have resources for critical care, critical crisis, but we also want to make it approachable and really build a sense of community and belonging. So UMCU being very community oriented, we have a lot of ways to give back to the community. We've implemented a give back committee, which is a wonderful group of team members that identify all the different ways that our team can get involved and give back to the community, because there is a lot of evidence behind community involvement and volunteerism and believing in your work, really giving back to the mental health and supporting your mental health. So some of the fun ways that we've really created a sense of community is through that give back committee, and they're doing very, very important work in our community. And I think that fosters that sense of community for the team. But then we also like to try to have fun with the way we approach things as well. One of my favorite programs that we run here is called an Elf on Day Off program. And I'll explain what it is. And are we solving the mental health crisis one elf at a time? I'm not saying that, but it's really fun. It's during the holiday season. Randomly selected team members get a little University of Michigan elf delivered to their home. And that means that the next week they get to take a day off of work, fully paid, in order to spend time either with their family or catching up on their holiday shopping during that very stressful time of the year. We like to do days like movie days, where we actually did that for the first time just this year. We rented out a movie theater, we showed a comedy, we had the team get together, and the support around it was amazing. Everyone said, when are we doing this again? So a lot of those fun, creative ways to just get the team together and get them having fun together and bolstering that sense of community.
So just as a follow-up to that,
Mm-hmm.
So these were individuals who all had to come into the office then, or how did you handle that issue?
Yes, and that is something that I'm sure we'll talk about a little bit more. And we do try to be, it's always so important to be inclusive. I'm sure Kate will have a lot of feedback on how at her organization they managed to accomplish that at such a large organization. We do try to find ways to also make that work for our team members that are remote, because we do have some team members, well, a lot of team members that work fully remote. We actually have team members located throughout 5 states. So we do try to find creative ways to be inclusive and still make it work for those team members. That's a little bit more challenging, but we're very much on the pulse of trying to make it work for everybody.
So Erica is really emphasizing that banks can be fun. I never would have thought of it that way, but okay,
Yes.
I'll take it. Now, can engines be fun? Katie?
They, interestingly, they can. We have all kinds of interesting names for our engines, but I would say that at Cummins, our approach has been less fun, but still, what has worked for us has been, there have been a couple things. One thing that I tell people all the time, if you have no other tools in the toolbox, use shared stories. They are so powerful. We have shared stories and testimonials. People love to hear them from our leaders, and they're very genuine. But all the way down to our shop floor, if I'm working on the shop floor, sometimes we find people don't particularly care about the shared story from our CEO. They want to hear about the shared story from their own leader, and as a frontline leader. So shared stories across the company have been super powerful, because everyone wants to connect with that whole, that I'm not the only one. But the other part that has really been, I think, interesting is that we do weekly meditation sessions called Mindful Mondays. And I really thought they would lose steam after a while. They don't. And we do something else called a safe space forum that we have monthly, and we also do them as needed. So if there's been a critical event, we will add new ones in so people feel, or if we have a critical event in a particular area, when we had the events surrounding the George Floyd's death, we had specific safe space forums at our plants that were in around Minneapolis. And so those types of things where, and we work with our EAP to help us create these, those are what really engage people, right? It's that idea that they can get in and they have a voice and they can do something that feels, when I say community, I mean that they are surrounded by other people who may be trying to get through something. So I would say, so I'm going to say no to the fun right now, but I do like your idea of it. If only we could figure out how to do that for 70,000 employees.
Well,
but
well, maybe the one way to have fun is might be connected with the shared stories. So I wanted to understand about the shared stories, whether the shared stories are only about like adversity and overcoming it, or could they be a shared story of a victory?
Well, I'm so glad you asked that, because one of the things that I have always said when we started It's Okay, people kept saying it's okay to not be okay. And that's not what I wanted, because I wanted it to be about wherever you are in your journey, it's okay. And so we also do, we've done gratitude. So every month we have a different topic. We've done gratitude, or we've done things like substance use disorder. We've done suicide prevention, like big ones on clinical disorders. But then we've done gratitude. My favorite month was the happiness month. We did a 6-week happy class through a provider here in Michigan that I had used in my prior employer, Visteon Corporation. And so, yes, we have testimonials that can be about victories, about gratitude. I did mine on happiness, on just understanding that happiness exists in the day-to-day. So yeah, it's really about, our tagline now is, wherever you are in your journey, it's okay.
Okay. Well, right now you're in the middle of a panel discussion, and is that your happy place?
Yes, talking about this is a happy place.
All right. So, what about the role of digital tools, artificial intelligence? These new age, well, not new age, that's the wrong term, but newer kinds of approaches, do these play a role? Because what we've been talking a lot, not just with this session, but throughout the day, is a lot about connecting with each other and relatedness and so on. What is the landscape, and what should we be thinking about artificial intelligence or digital tools? Erica, do you want to tackle that?
Yeah. Now, being a smaller organization, a lot of our, so I'll be interested to actually throw over to Kate shortly. A lot of what we do is in person, but we are looking at what do those digital tools look like? One thing that we utilize here at UMCU, and I'm going to pause and just say, if my lights go out again, I apologize. I'll turn them back on if anyone noticed that. So we do utilize a very robust employee assistance program. And when I say robust, I almost don't want to call it an EAP because it's so much more than that. It's through a company called Uliance, and it's their Life Advisor portal. It's all digital, all online. And it really covers everything from those crisis moments where you have to have a therapist on the phone immediately 24/7 to many different aspects of well-being. It could be career coaching, which we do mostly internally, but if someone wants to go externally, they do offer that. Wellness coaching, if you're having trouble quitting smoking, just adopting a healthier habit, they cover from the crisis care to the full scope of holistic well-being, and it's completely confidential. So that is the primary way we utilize an online portal and digital resources to help with the well-being of our team members.
Yeah, that's great. We're very similar, Erica, in that. So we are spread out around the country and the world. So for instance, I live in Michigan, right? My company is in Indiana. So if it wasn't for Zoom, we couldn't do this. So we use a lot of, we're able to, our EAP is Lyra Health. And so they're able to produce a lot of material for us. They are not our global EAP, but they still create content that someone can access wherever they are in the world. So because of things like Zoom and Teams. And so that's been really helpful. We know that there is a national shortage of behavioral health clinicians or providers, right? So we know that we moved to an EAP that really had a focus on virtual care and for instance, Lyra is working on ensuring that their counselors are licensed in all 50 states, so we can just get more providers to be able to take care of our employees. So that's been a big piece of it. We also last year we worked with we hired at the beginning of this, a small communications marketing firm based out of Indy and Detroit to help us create a distinct look and feel to this program. And so we developed a website, and what that website lets us do is anybody can access it. So our employees, we have a lot of non-wired employees. The non-wired employees, their families, and they can get to the information quickly wherever you are in the world. And the beauty was we spent a lot of money on translations. Half of our budget was translations alone. AI came along and got better. And so now we translated to about 23 languages. We do just a few less than that. I want to say like 19 or 20. And then we still have to translate a few, but it saved us an enormous amount of money and has really at this point become better than human translations. So that has allowed us to be more nimble, get our information out more quickly. And so and I am the last adopter of AI. So the fact that I think this is such an incredible thing is really amazing. So.
Well, you've really emphasized that you want to make the material accessible, and one way is, of course, having it in multiple languages. Many innovations, not just in this field, but just broadly speaking, many innovations don't get uptake because there's not enough essentially advertising about it or enough awareness. So both of you have outlined a number of initiatives that you're proud of in your company, but how do you get the message out, and how do you know that people are actually getting the message other than saying, I sent out 70,000 emails, a mass email, or how do you know that they're getting the message out?
Well, I'm happy to share this because we have we have a lot of people to get the message out to, and I will start out by first saying, so we have a large manufacturing population, and we have not mastered getting it to them. We do our best, but that's an area we are still working on. We have a network of global communicators and Total Rewards staff around the world, so we connect with them. Our global communicators are really important in getting the message out. But you know, we also have around the world, we have 35 on-site clinics. And so we have a clinical operations staff that we use, and that those clinics are like in India, they're intrinsic. They are the voice of this whole program. So we try to use what we have. We are creating, we have started and now launched a mental health training program similar to a first aider training program for our frontline managers and employees, is because it's literally showing up in the plant is the only way you can really get to those people. But how do we do it? And so we're also developing a mental health ally or champion program that's in the works for next year, that I'm hoping will help get that out. But outside of that, we use emails, we use home mailers in the US. We have, we've got manager toolkits so that if you're in the plant and you're having staff, or you're anywhere and you're having staff meetings, you can talk about it. And then, we try to get results through pulse surveys, and through any kind of voice of the customer that we do. And I will tell you that I hear from employees all the time. So I know we are getting through to a large number. The manufacturing employees, though, remain sort of our outlier.
Yeah, well, I think one of the emphasis of this particular conference is we try to identify not only winning, overall goals or strategies, but some practical points that enable the victory to happen. And so, what you've identified is that you are able to get the message out there, but you use a diversity of techniques. And one of the most important ones is use the framework that you already have.
Yeah.
So you cited the fact that you already have 35 clinics. Those clinics are where people already have some awareness that if I have a health problem, I go there. So if there's information that's flowing out of these clinics, it's a natural place for people to turn to. You also emphasize that you're trying to develop local champions. Certainly in our research and in our experience at our mental health workplace solutions program, we've found that selecting certain employees and training them to become champions so that they are they're the peer champions. They're not like somebody up on the hill who says, consider this, but it's a more local person that people can relate to, giving them some tools, not just about the basics of training, like we've heard a lot about training managers, but also giving them some awareness and role within the organization as advocates. So I know I can go to that person because they are an advocate for mental health or whatever. That's been useful, and it sounds like you're developing that program now.
Yeah.
So, Erica, would you say that there are any strategies? Maybe that's not as necessary for a smaller organization. Maybe you can go knock on their doors directly. But what are your strategies for making sure that people are aware of the various activities that you're doing and the various approaches that you have?
Yep. Even being a smaller organization, branding is important, and Kate had mentioned that as well, working with brand and marketing on it. So we do work on a branding perspective from it and really looking at where we can tie it in. It may not always necessarily be like our full court wellness program. It may be in partnership. So we'll do that a lot. We have the Give Back Committee, which I mentioned earlier, and we always do a partnership with them on an annual basis around the American Heart Association. So we pay a lot of attention to branding and how we can, again, layer in, I said I was going to use that word a lot, how we can layer in the awareness around our wellness program and kind of tie it in with other opportunities and initiatives that we have.
Yeah. So what you're saying, in other words, is it has to be reinforced. I mean, there's a reason when when a commercial entity advertises on television, you see the same commercial like 100 times or something, because repetition is important. And I think we sometimes forget in the healthcare field that we need to get our messages across, and that means using a variety of approaches and repeating the message, even though we may think, hey, I already delivered that message twice. Why should I say it again? But you actively have to champion your program repeatedly, and then people, keep on thinking about it. One of the issues that people have sort of danced around is like, how do we measure whether these things are working? All right. So is it surveys of employees? Is it ratings of symptoms of people who use services? Is it retention rates in terms of, hiring? How do we measure success when a company has a good mental health strategy? And I'm wondering if you've found any approaches to begin, because I'm sure, both of you are called upon by higher ups to say, hey, it's a great idea, a good program. How do you know it's working? Or how can I justify it to the shareholders, so to speak? So, Kate, do you have some thoughts on that?
I do. I would like to tell you that I see it in our retention numbers, but I cannot see that yet. But I will tell you that there are a couple different ways. First, we went from, and this is also, I guess, a watch out too. We went from having in the US, we have EAP programs around the world, but in the US it's through LIRA, which is significantly more expensive than a traditional EAP. We went from 0.5% utilization to 5.5%, almost 6%, which doesn't sound like a lot, but it's a lot for EAP. So we know it's working because people are actually, and even in my past life, anytime you do a communication about your EAP, you'll see a little spike, but we're sort of keeping our foot on the accelerator. So there's always a spike. So that's one way. We have a website now. So we actually actively follow like how many unique IDs are accessing information, our click rates, our attendance. We do podcasts, we do webcasts, we do all kinds of things like what's our attendance. And we use that data to sort of refine what we're doing, how we're communicating, advertising, that sort of thing. And then, we have either our website has a survey tool on it where people can provide feedback, ask for ideas, that sort of thing. And then again, we hear from employees. I will say we do this not for the ROI. I had someone ask me a couple of weeks ago at a presentation, well, how do you talk about ROI? We don't. This program we're doing costs us money. We do not save money. We do not, we do it because it's the right thing to do and because it helps our employees. So it's also hard to measure sometimes. But so to the best that we can, those are the ways that we measure. But having that website has really, really helped us.
I think, you've got a lot of good measures there, but I do challenge you on the ROI question. It may be that your organization right now has the idealistic leadership that says we're willing to spend on this.
Sure.
But not all organizations do. And even organizations that have that idealism may not have the cash, and they have to be more careful. So I think one of the challenges is to identify some strategies for how you measure success. One aspect of it is ROIs, return on investment, but others might be, certainly for educational events, for instance, we have a layering of outcomes. So the first one is the one that everyone gets asked, and that all of you attendees will get asked at the end of this, what was your satisfaction with the event, and did it meet your learning needs and things like that. But then there are additional levels that when we're actually evaluating educational events, we can give quizzes to see if people learn something. And in the case of healthcare, we can actually look into whether the patients treated by the individuals who attended the education event, whether the patients, were subjected to a different kind of exam or testing or or whatever. So we can, measure downstream the impact of the education. So I think it'll be really important to make this sustainable, that we develop a series of outcomes that we say, okay, here's our satisfaction with our workplace mental health program, but also here's some other things, and retention of employees would be an important one. And later on, some aspect of the cost benefit analysis would be helpful. Erica, what about measuring success? Is it just one big happy family at the UMCU, and everyone says, Erica, here's some money. We're a bank, you can spend it, or do you have to justify it in any way?
So this question came up at a panel I actually did about a year ago, and the group kind of went back and forth a little bit, and I got to thinking, and I'm like, I think you can see it, pieces of it, you can see it in everything, because ideally you're impacting the performance, you're impacting the engagement. So I think you can see it in a lot of what you measure, but it's also a pulse on the organization. How does the leadership team feel the organization is doing? I think there is an innate pulse, but I know that's going against what you said about ROI still being important to show. So I just gave a very UMC answer to that, right? But I do think that you can feel it within the organization. I think one thing that's important to keep in mind, though, is the world clearly is throwing us a lot of curveballs and ever changing. So you may have your metrics down pat, you may be showing you ROI, and then you may have a little change and things, you question, how are things going? And I just say that to say this needs to be ever evolving. And as things change on what feels like a daily basis, sometimes we'll have our tenets that we hold true with our approach to mental wellness and mental health in the workplace, but then we have to adapt as well. So I think we can see some changes in some cycles that will still inevitably happen. And it just means it's time to make a change to our program or emphasize something in a different way.
Okay, Erica, I'm going to stay with you here.
Mhm.
We're in the final stretch, and what I'm going to ask is the same question to both of you, and that is, if there are a couple of things that you've learned from initiatives that you've done in your organization, if you could think which would be the ones that would be the most easy for another organization to attempt. And, I mean, the easiest thing is just, send out an email and do an educational campaign online or something. But if it can be something that you think has real value and is potentially doable and explainable and doable to another organization, what would you suggest? What would be a couple of things?
Yeah, I think twofold, and I'll try to hit these fairly quickly. Or a couple-fold, I should say. I do think that when we started our initiatives with the Depression Center and had you out to work with our leadership team, we did set a standard that has trickled down throughout the organization and really set a standard for how we look at mental health. And then we also look at leading with empathy. Leading with empathy is free. You might have to give some coaching to your leadership team, but those leaders, and we've talked about that a lot today, our prior panelists have talked about it quite a bit, but that leading with empathy, like I said, that's free and that can have such a big impact. And then outside of that, look at, especially if you're a small organization, you're saying, how can I start? Don't worry about coming out with a bang. Incremental changes are fine. Introduce things where you can and then grow off of them. Maybe look at your policies and see, where can I have a little wiggle room with my PTO policy, with my sick policy? We have a policy here that's an emergency sick time fund where team members who are out of sick time can receive donations from other team members to cover their time off. And when we're able to do that, it's really powerful and it's really great to be able to take care of the team members that way. So yeah, I would say look at incremental changes. You don't have to do it all at once, and just look at where you can influence change in your current day-to-day.
Well, Erica, I've never heard of that policy of being able to donate your unused sick time to somebody else. But to me, that just resonates in so many ways, because that builds teamwork. That makes the person donating the time feel good. It makes the recipient feel good. I think it makes the organization feel good. Wow, that's wonderful. Sorry,
yeah, it
Kate,
has a really great impact. Sorry, I didn't mean to interrupt. Yep, go ahead.
Go ahead. No.
No,
No.
Yeah.
Oh, go ahead.
We're all very excited about the emergency sick time fund. I was just going to say it has a huge impact. It does. And the team members that receive the time are so grateful. So that's it.
Yeah, well, no, all I was going to say is, Kate, top that. Okay.
Well, I will say that there's a couple things. Exactly what Erica said, you know, I have thought often, I understand, I concede I work for a fantasy company right now, right? Anywhere I came from in Detroit in automotive, this would not happen. And how I've thought many times, like, how could you do this? And I would say there are a couple of things. Make sure you have leadership support, because once you have it's a top down, trickle down, support that you need. But to start small, I think we start off with grand ideas, and if you can't make them actionable or operational, they won't work, they won't be sustainable. So start small and take an inventory of what you have. So, you know, we really looked at what do we already have that supports people. So we have these clinics. We had just put in place an expanded parental leave policy. We also have a discretionary leave. So we added a leave program. So we don't have mental health days, but we have a discretionary leave where you can take up to 2 weeks for any sort of emergent situation that you might have. And that has been really helpful to people because, you know, we don't have mental health days. So, but we started by looking at what do we already have? We didn't put, when we started, it's okay, we didn't put any other new programs in place. We really took an inventory with what we have. And so if you are a small company and you have an EAP, and let's say that's it, and maybe you have a decent, you know, time off policy, and you get your leaders to say, I really want to do this. It's, if you can just talk about it. And I think the key is, don't talk about it once and then move on to something else. Talk about it, maybe use different words every month, but talk about it on a consistent basis so people don't forget, and they know that you meet, that there's an authenticity to staying on topic. And even if it is just to remind people every month that you have an EAP, you've got a good PTO policy, and we want you to use it. That's what your employees need to hear. They need to hear you or the leadership team say, it's okay to do this. And it really frees people up. I would say that's the biggest thing. Use what you have.
Thank you, Kate. And again, what I'm learning from that is that a basic principle of human learning is repetition. And also, when we think about mental health days or leaves or special considerations, everyone feels, because it's not a historic tradition, everyone feels a little bit shy about using these kinds of things. So if you're able to say it's okay, if you have needs, and it's all right. And in fact, we encourage you to use things that are available to you. And your company has chosen to keep it very flexible as a special leave policy. And maybe that's even better in some ways, because it doesn't have any potential stigma associated with it. Because if we actually said, oh, how many mental health days are you using? That might be intimidating for people to say, well, I'm taking a physical health day, a mental health day, whatever health day, right? But so it's good to have flexibility. I think we just have time for one or two comments or questions. I see an interesting comment here that from Vicky, one of our previous speakers, who says that the U.S. Department of Health and Human Services also allows sick time donation. So believe it or not, the government is actually doing it. Vicky, you know, I gotta see this to believe it. But if it's true, I mean, my hat's off to that government agency. But you heard it first from the UMCU. So there. I think we are actually out of time. I really want to thank both of you. I think what you both have demonstrated is that, number one, your organizations give a damn. And number two, that both of you are passionate about getting the message out. And I think the fact that you like your work so much probably means that you'll be retained by your employer for a long time. So congratulations to you, and congratulations to your employers. And thank you so much for your contributions today.
Thank you both.
Thank you. Thank you for having me.